Just some general things to consider that are helpful in terms of immediate post-operative information, just some guides. One thing is hydration. So if you get dehydrated, you're more likely to be nauseous, you're more likely to get dizzy, you're more likely to just feel sick and get headaches. So hydration is really important. Even if you don't feel like eating much, making sure that you're well hydrated is important. So plenty of liquids is important in terms of your initial recovery, the first day or so especially. The narcotics can make you a little more nauseous, and if you are not hydrating because you feel nauseous, then it becomes a cycle that can become a more difficult problem right after surgery. In terms of the medications that we use for pain control, we will give you a narcotic on the day of surgery, the actual prescription. The other medications that we use during your recovery are made available to your pharmacy. They're directed to it electronically, and those are available for you days before your surgery. But the narcotic itself, the prescription will be given to you on the day of surgery. There is a list of medications that are in this packet, and there's several medications that we use after surgery. For details about them, please look in the packet. The actual dosaging and the frequency of the dosage is also on the medication bottles themselves, so please refer to that to understand what you should be taking after surgery. There's a couple things related to avoiding complications that I'd like to go over. One is related to infections. So infections in hip arthroscopy are super rare. So in order to prevent having superficial infections, we encourage you to keep it covered regularly. At the beginning, it's with a bigger bandage just after surgery and maybe for the first day or two. After that, it can be simply just Band-Aids on each incision. The incisions are small, and just keeping them covered with a standard routine Band-Aid can be enough. But that helps to prevent jeans or underwear, something, especially if it's tight fitting, from rubbing on it as you're moving around and potentially causing an infection. A second complication that we want to avoid and is really important is blood clots. Blood clots can be deadly, and so we do a number of things to prevent blood clots, and together they're quite effective. I haven't had any blood clots in over 3 years, and it's really because of the combination of these factors. So first, we're going to use some compression socks. They're tall socks that come all the way up the thigh. The second is the motion machine, which I'll be demonstrating for you. Third is ankle pumps. And it simply is just pointing the foot all the way down and pointing the foot up. This movement's through the ankle, and doing that for about 30 seconds or so, every 30 minutes or so. So for about 30 seconds every 30 minutes, and while you're awake. And the motion simply of going up, down, up, down, up, down, up, down. The ankle alone, regardless of the position of your knee and hip, helps to increase the blood flow throughout the whole extremity and helps to prevent clots. So this is one other way that you can help yourself in terms of preventing any blood clots. Lastly, we have you taking non-steroidal anti-inflammatories, the naproxen, or one of the medicines from that family of medications, and that also helps to thin the blood a little bit and prevent clots. Patients are very interested in when they can start driving again, so I want to go over that. Overall, in terms of driving, you cannot be taking narcotics to drive. So first and foremost, you can't be on the Norco or any medication like that when you're driving. Once that's stopped, which is typically 3 to 5 days after surgery, you can drive, and the guidelines differ depending on whether it's your right or your left leg, and I'm going to go through those with you. For the right leg, we do not want you to use the leg repeatedly before 6 weeks. And by that I mean, especially in Atlanta traffic, there's big differences in terms of how much time people are driving, and especially on and off the brake and the gas. And so I would like you to avoid traffic in terms of being on and off the gas and long time, meaning more than 20 or 30 minutes in the first 6 weeks. It generally causes a lot of irritation and discomfort, There's a big difference between going to your local Publix and grabbing something to eat compared to driving for an hour and 15 minutes in traffic in order to get to and from work. And so for those first 6 weeks with respect to the right leg, just be careful, listen to your body, and keep it to a minimum as much as possible. Related to the left hip, the only real guideline is that you are not on narcotics. One other thing that tends to happen is that with any sort of prolonged sitting, patients get uncomfortable, especially in the first 3 to 4 weeks. So for the left hip, the complaint I may hear sometimes is if I drive for too long, it just gets uncomfortable and I want to change positions. So in that scenario, you probably want to drive 20, 25 minutes and get out of the car, stand up, move around a little bit, or just keep your distances to a minimum. Related to how much weight you can put on your foot, what we do is called partial weight bearing, and it's about 50% of your body weight. So what that means is in order to put 50% only of your weight, first of all, you can try it even like on a scale, on a weight scale. You can put about half your body weight on and just see what that feels like. The second part of it is that you have to use crutches in order to do 50% of your weight. And so for those first 2 weeks, you're using crutches regularly and you're minimizing the amount of weight on your foot. The next thing I want to demonstrate is just supporting the leg. So especially if you're sitting or lying down, if you want to get up, and that would be, for example, getting out of the car, getting out of bed. In the first 2 to 3 weeks especially, and even possibly up to 5 or 6 weeks depending on comfort level, you can actually take your hands, rest them underneath your thigh, and lift up your leg as you do those types of rotations. So for example, if assuming that this is a car and I'm getting out of the car, I can use my hands, grab the leg underneath it, and just swing it over in order to swing my whole leg out of the car. And so that additional support just takes stress off the front of the hip, which is where a lot of the work has been done, and helps to minimize any pain that you might have in the front. So here I'm just demonstrating what's called toe touch weight bearing, and you can put about half your body weight or less on your foot. And so what you can see is that I'm touching down with my toes alone, and what you can do is about half your body weight onto this or less. And you can test that with a weight scale if you'd like at home, getting an idea of how much weight that is, and along with your crutches. So toe touch. You need to bend your knee a little bit. Hips typically flex just a little bit, touching down, and it's primarily for balance. In terms of following up with you, we'd like to see you at specific intervals or time frames right after the surgery. So the first is at a week, the next is at 3 weeks, followed by 6 weeks, 3 months, 6 months, and then finally at the 2-year mark. The 2-year mark is an important time frame in terms of judging success, and we'd like to see you in the office at that time as well. Thanks for your time. We are looking forward to working with you to ensure success with your hip arthroscopy. Please let me know and let our staff know if there's anything we can help you with. If you have any questions that go beyond what's covered, either via this video or through the packet, please reach out to us. We are here for you, and we're going to get through this together. Thank you.